Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Today's program is part of our Climate Change and Health series, a special collaboration between the Blum Center, the Mass General Center for the Environment and Health, and the Mass General Institute of Health Professions Center for Climate Change, Climate Justice, and Health. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so that we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and the guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we would like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next, I would like to introduce you all to our guest speaker, Dr. Patrice Nicholas. Dr. Nicholas is Distinguished Teaching Professor and Director of the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. She is also the Co-Director for Policy and Advocacy of the MGH Center for the Environment and Health. She teaches in the Doctor of Nursing Practice program and advises accelerated Bachelor of Science in Nursing students at the MGH Institute. She also serves at the MGH Center for the Environment and Health on behalf of the Department of Nursing and Patient Care Services. As part of our Climate Change and Health series, she joins us today to give a talk on the mental health impacts of climate change. So please join me in welcoming Dr. Nicholas.
So today, I'm your speaker as the director of our Climate Center and appointed at the MGH Center for the Environment and Health in the Department of Nursing. And our co-speaker who couldn't join us today, who also developed the slides, is Dr. Suellen Brakey, who's the Associate Director at our center. We know that climate change is one of the greatest public health challenges of the 21st century. In this slide, you can see that there are climate drivers that include increased temperatures, precipitation extremes. In the Northeast, we anticipate more rain. However, this particular spring and summer, we had drought-like experiences. But in the past few years, we have had precipitation extremes in the form of rain. There are also extreme weather events, hurricanes most notably. And as you may have heard, Puerto Rico has no power at this time because of Hurricane Fiona. Hurricanes are increasing in velocity and wind speed. There's also sea level rise, and in the Northeast, we anticipate extreme sea level rise going through to the year 2050 because of the convergence of two water masses and the Arctic and Greenland ice cover melting because of climate change. The next arrow shows exposure pathways. There is extreme heat, there's poor air quality, reduced food and water quality that occurs because of the warming of the planet, and also as a result of disasters. There are changes in infectious agents. Many of you may have joined when we talked about vector-borne illnesses in July and July, August, and the fact that there are vector-borne agents such as Lyme ticks and EEE carried by mosquitoes that are very dangerous for human health. There's also population displacement, so climate migration is fueled by conflict and violence, as well as heat stress and disasters. And then these result in health outcomes like heat-related illness, which we've covered previously in this series for the Blum Center, cardiopulmonary illness, including respiratory illnesses like asthma and exacerbations of chronic respiratory illness, and also cardiac disease, where heat stress can exacerbate existing cardiac disease. Then there are food, water, and vector-borne diseases, and mental health consequences and stress, which is the focus of today's lecture. You can see on the left-hand side, there's an environmental and institutional context. So there's land use change. So land changing over, particularly in countries such as Central and South America, that lead to climate migration. Ecosystem changes, so farmers experience this with drought conditions, for example. Infrastructure conditions that exist in all kinds of climate-related conditions, but particularly the infrastructure, for example, in school systems where hot environments may not be moderated by air conditioning, and children may be affected by heat stress. Geography, so across the United States, there are differential conditions related to climate change that occur. And then agricultural production and livestock use. For example, cows emit methane. So cattle production is actually a major contributor to climate change. And then we have the social and behavioral contexts, age and gender, older people, younger people. Women are disproportionately affected, race and ethnicity. I think I've addressed previously that pregnant women, particularly Black women, are disproportionately affected by both heat stress and poor air quality. And this can also lead to adverse pregnancy outcomes. Poverty, because poorer areas are exposed to more conditions that are influenced by climate change, particularly air quality, poor housing and infrastructure, education. So greater levels of education can differentially teach people how to avoid climate change related health challenges. Discrimination, BIPOC populations disproportionately affected. Access to care and community health are incredibly important for educating people about climate change conditions and mitigation and adaptation to climate change, and then being resilient amidst climate change and pre-existing health conditions. We've shared this from the Centers for Disease Control and Prevention. There are impacts of climate change on human health. Please look at the center where you see that there are rising temperatures, more extreme weather, sea level rising, and increasing carbon dioxide levels. These are all incredibly important amidst greenhouse gas emissions. And then you can see that there are water quality impacts at the lower right hand that include cholera, cryptosporidiosis, Campylobacter, leptospirosis, and harmful algal blooms. In layman's terms, these are all ways in which poor water quality occurs because of climate change. To give you an example, after the earthquake in Haiti, there was a major cholera outbreak because of the poor conditions that occurred and the lack of fresh water and resources. This also occurs frequently after hurricanes and lack of resources. Water and food supply impacts. So there can be malnutrition and diarrheal disease, particularly after disasters like hurricanes that are influenced by climate change. Environmental degradation, including forced migration, civil conflict, and mental health impacts, which is the focus of today's content. There's a great series in the New York Times magazine by Abram Lustgarten, Lustgarten. It's a three-part series that looks at climate migration at the southern border of the United States, and that in fact, in addition to conflict and violence related to gangs in home countries, that there are also there's also environmental degradation. For example, in Central America, there were 2 hurricanes back to back that destroyed many of the crops that were growing. leading to families exiting their home countries, although they would have preferred to remain in their home countries. Extreme heat that leads to heat-related illness and death and cardiovascular failure. Severe weather that leads to injuries and fatalities, and in particular, mental health impacts because of loss of homes and livelihoods. And the southern area of the United States, as well as the island of Puerto Rico and the islands of the Caribbean, are particularly vulnerable because there's an increase in prevalence of hurricanes. And then air pollution impacting asthma and cardiovascular disease. Changes in vector ecology that include malaria, dengue, encephalitis, hantavirus, Rift Valley fever, Lyme disease, chikungunya, and West Nile virus. And these are carried by ticks and mosquitoes. And then increasing allergens, respiratory allergens, and asthma. Many people who never had allergies previously are now experiencing them because of the longer season of heat in the spring and the fall, leading to more exposure of previously healthy people without allergies who now experience them. So people and communities differ in exposure, sensitivity, and adaptive capacity to respond to climate change. So what is exposure? It's contact between a person and one or more biological, psychosocial, chemical, or physical stressors, including stressors affected by climate change. And related to the topic today, exposure, for example, to disasters or extreme heat can lead to mental health stressors that are quite dramatic and quite stressful for people in the community. So conflict and violence has often been seen in summer months, and often it's been attributed to the fact that people are outside. But however, it may be even more so related to the heat stress, high heat, that leads to conflict and violence among peoples and populations. Sensitivity is the degree to which people or communities are affected, either adversely or beneficially by climate variability or change. So for example, sensitivity in a heat stress environment can lead to mental health challenges that otherwise would not be occurring. And then adaptive capacity is the ability of communities, institutions, or people to adjust to potential hazards, to take advantage of opportunities, or to respond to consequences. So for example, in heat-stressed environments, people may experience mental health consequences when they don't have, for example, air conditioning to moderate the heat that they're experiencing, whereas other people may benefit from having access to air conditioning. And then those lead to vulnerability, and then the health impacts, the injury, acute and/or chronic, including mental health and stress-related illness. There can also be developmental issues and death. So let's talk about the major acute mental health impacts of climate change. These can include anxiety, trauma and shock, post-traumatic stress disorder, particularly after climate change related events such as disasters such as hurricanes. So after Hurricane Katrina, the incidence of anxiety, depression, post-traumatic stress, substance use disorder were dramatically increased in the New Orleans area. As a matter of fact, there was a nearly 50% prevalence of these mental health impacts. I think it was 48.6%. For people who relocated to the Houston area, the prevalence was close to 25%, which is still 1 out of 4 people, but significantly lower than the experience of people who remained in the New Orleans area, which was 1 out of 2 people experiencing these incredible mental health challenges. It's important to note that the effects of climate change aggravate existing mental health conditions and their associated risk factors. So for example, if there is a homeless population that lives in a climate stress environment, that is significantly affected by, for example, hurricanes and disasters, that population will then experience increased likelihood of exacerbation of existing mental health conditions. I'm just trying to move my slide forward and it seems to have frozen. Sorry about that. There we go. Here's the slide that amplifies or illustrates extreme weather events and the impact on mental health and well-being. You can see on the left slide, the left part of the slide, PTSD, which is post-traumatic stress disorder, significantly increased after a year post-Hurricane Katrina. The same is true for serious mental illness, suicidal ideation, and the existence of suicide plans, all after Hurricane Katrina. And this was a very large study, and also in the resources of the American College of Cardiology. The other thing that can occur with mental health challenges are strained interpersonal relationships. So despite the fact that people, it may experience, for example, exposure to hurricanes and the post-disaster experience, some people draw together. The reality is that family relationships, including intimate partner violence and child maltreatment, are significantly increased after disasters. And social connections are frayed, particularly for older adults, and then also climate migrants. So I mentioned the New York Times series by Abram Lustgarten. He actually profiled the family of a successful coffee farmer who unfortunately experienced the 2 hurricanes, lost their entire coffee crop, and because they had no way to, he had no way to feed his family, they then went on the difficult path to migration to the southern border of the United States when they really had no plans to exit their home country. And the social connections that get frayed in those circumstances for climate migrants are really extreme. With major chronic mental health impacts, there's evidence of aggression and violence, and this is particularly evident in the literature and sociology. So there's a causal relationship between heat and aggression that's very well established in the sociology literature. And as I mentioned, often in the health professions, we think there's heat stress, but it's really from people being outside. They're converging in areas where people, there are large numbers of people. They have access, for example, related to firearms. And violence then occurs in those heat-stressed environments, but occurs less in the winter months when people are less likely to be outside. But there is a causal relationship between heat and aggression that is well known to impact arousal. In other words, people are more on guard, and it leads to decreased attention, and they also have less likelihood of regulating themselves. So in a heat-stressed environment, people experience a lot more, the heat stress leads to them being more on guard. It leads to them being more likely to react very quickly and not thoughtfully to complex environmental challenges and being approached by other people. Heat stress also has a negative impact on cognitive function and the ability to resolve conflict. I think I've mentioned in a previous presentation that in school environments, PBS had a segment on the fact that for every 1 degree increase Fahrenheit in temperature, children are learning 1 degree less. It was a very robust study that was able to control for climate, for temperatures, climate modeling, air conditioning in schools, and social determinants of health. So children are learning less in old brick schools without the ability control for high temperatures. And also this is true in heat-stressed environments and communities. So we know that increases in mean temperature are associated as well with increased use of emergency mental health services, EMT services, emergency medical technician, ambulance services, and also use of emergency departments. Dr. Ari Bernstein, who's the interim director of the Harvard Center for Climate, Health, and the Global Environment, actually had a recent study that looked at emergency department use at Boston Children's Hospital, and they were able to find that there was a significant increased use of emergency services at Boston Children's related to climate change and heat stressed, as well as particularly heat stressed environments, I'll say. Just moving the slide forward. So thinking about emerging chronic impacts. So we have solastalgia. This is a concept that's fairly recent in the literature. Not first written about, but this was a significant paper by Albrecht. And it's defined as the pain or sickness caused by the loss or lack of solace and the sense of isolation connected to the present state of one's home or territory. Oh, let me go back, sorry. And I can speak for myself, and I wonder if all of you could ponder this as well. This past summer, we had, I believe it was over 20 days of 90+ Fahrenheit weather, accompanied by high humidity, which amplifies the temperature. So anytime you think about high temperatures, for example, in the Northeast United States, often it's accompanied by high humidity, which then amplifies the temperature into the 100+ area. Whereas in the Southwestern United States, the temperatures may be high, 105 degrees, for example, but the humidity may be quite low, 35%, for example. So their temperature isn't amplified in the same way that it is in the Northeast. But I know that I had a deep sense of sadness thinking about our climate changing world when the days were in the 90+ degrees. And I was looking for meteorologists to really draw our attention to the fact that it's a climate changing world that's occurring, so that all of us are well aware that there are changes that we must be attuned to, and we must think about how we engage with policy and advocacy, contacting our legislators, et cetera, about climate change and efforts that they should be engaged in. So there's also a sense of homesickness one gets when one is still home. So for example, in our environment, with a heat-stressed environment, it's particularly important to think about that. But again, think about climate migrants who really have to exit their home environment when they can no longer feed their families. There's also the recognition that the place where one lives and loves is under immediate assault. That's particularly important. And the indigenous communities are at particular risk. So Native American communities in the United States, there's literature readily available if you Google it about the how indigenous communities are affected by climate change, and affected more profoundly in many ways in the United States. This slide illustrates sources of environmental change causing solastalgia. So this is in a paper by Galway et al. And what people identified as reasons that they experience solastalgia. So you can see that there was extreme weather events and natural disasters. Not surprisingly, those happened extremely quickly. The floods in Kentucky that occurred recently, the drought in the Northeast United States and across the country affecting farmers and others. Hurricanes, similar to Hurricane Fiona in Puerto Rico, those are significant reasons for solastalgia. Climate change in general was identified. Prolonged environmental transformation. One exemplar would be the significant increase in wildfires in the Western United States. Land clearing and deforestation, for example, in Brazil, where we know that the Amazon is at risk and is a significant reason that we can avoid climate change, but the current government is doing great harm in the Amazon with not thoughtful land clearing, resource extraction and development. So, for example, we're delighted that there was a significant climate change bill passed recently by the House and the Senate. And Senator Joe Manchin was the linchpin vote in that from West Virginia, which is a significant source of mining and livelihood and employment from mining. But that also has an impact on climate change. Gentrification and or changing the built environment. So we know that urban heat islands where there are not enough trees, there is growth in significant building development that may also reflect heat that makes it hotter is another area and source of solastalgia. Displacement or appropriation of land and political violence and war. So the conflict and war in Syria was fueled by a multi-year drought that whereby cattle and livestock died and farmers lost their land, their farms, moved into the cities. There was a significant evidence of what the haves and the have-nots had, which led to conflict. And it then led to significant violence, and then the Syrian war, which then led to climate migration into the Middle East, including the migrant camps in Jordan in particular, and then migrants also into Greece, Turkey, and Western Europe. And then there's also rapid industrial development, which is causing a source of solastalgia as well. And then ecological grief is another source by Contextual et al. And this is the loss of nature and ecological surroundings, which can lead to anger, frustration, and helplessness. You may remember the Children's March that was in March of 2019, the year before COVID, led by Greta Thunberg from Scandinavia. She actually crossed the Atlantic in a wind-borne boat rather than flying in a plane, which we know contributes to climate change and greenhouse gases, or even a boat that uses energy to cross the Atlantic. And that was a significant march by young people surrounding their sense of ecological grief and the sense that the older generation isn't doing enough to help assuage their ecological grief about the environment changing, about greenhouse gases being emitted, and what kind of world they will be left with. Eco-anxiety goes along with this, and that is the distress related to the climate and ecological crises. And its associated feelings include worry, fear, grief, despair, guilt, shame, and hope. A colleague of mine sent me something from Instagram that colleges are starting to not only have counseling services, but also look at counseling for students and perhaps faculty too, who are experiencing significant eco-anxiety and solastalgia, along with other feelings of anxiety. This is from the climate protest, and you can see the sign. I'm sure the dinosaurs thought they had time too. And you can see it's significant numbers of young people really wanting to protest about what is happening with the world that they will be left with. So young people, this is from Marx et al., young people feel troubled by the state of the world and the loss of security for their future. The younger generations worry that the world will end in their lifetime. They can also experience added confusion, betrayal, and abandonment related to adult inaction and failure of governments to prevent harm. And they really see this as a moral injury, that it's a moral calling to action that really must be addressed. And without action, it's a moral injury for what's left for young people, for the future of the planet. So what do young people think? This was an international survey of 10,000 young people from 16 to 24 years. Over 60% felt very or extremely worried about climate change. Greater than 45% indicated their negative feelings and that these impacted their daily lives, many thinking about climate change daily and what it means. 77% indicated the future is very frightening. I know that in thinking about summer camp, not this past summer, the summer before, my son and daughter-in-law and I thought carefully about summer camps, and my granddaughter, who at the time was 6, went to 2 indoor summer camps, one at the Museum of Science and another one at another indoor camp where air conditioning was available on significantly heat-stressed days. This past summer, she also attended an indoor camp for one month. It actually wasn't air conditioned, but there was relief from the outdoor temperatures, which on many days were 90 degrees or higher. And then we have to think about the school situation where many schools are older and not air conditioned and how that impacts learning. So an eco-sociological approach. So these are highlighted as among the holistic nature approach to public health. You can see that it identifies both social and ecological factors as key components of health and well-being of current and, most importantly, future populations. The social determinants of health are embedded in an eco-sociological approach. So there are socio-economic impacts, there are cultural impacts, and environmental conditions as well that impact health. And then the environmental determinants of health that include water, food, access to water, food, and natural resources, and how they are impacted by environmental changes. So we know that globally, women and girls are often, most importantly, those who seek out water, and unfortunately, they may have to travel further and further to get access to water in a climate changing world, which we know then impacts their ability, girls' ability to become educated. It's also true when they have to access water that in some areas that are affected by violence, that they may be at risk of violence in seeking water, which is a significant concern in a climate changing world. And here are the references: Albrecht, who had the paper on solastalgia, Clayton and colleagues, who had a paper on mental health and our climate changing world. And this is from the American Psychological Association and Eco America. It's a very good paper that you can Google. Gislason, who had the interplay between social and ecological determinants of mental health for children and youth in the climate crisis. And I think this is an open access journal. And then Marx et al., Young People's Voices on Climate Anxiety, Government Betrayal, and Moral Injury. And then Sue Ellen Brakey and I had a paper on the economics of climate change and the intersection with conflict, violence, and migration. That's in Nursing Economics, and it actually examines violence globally. So we looked at various regions, the Northeast, the North America, South America, Europe, Asia, and Africa. And Africa in particular has significant impacts related to climate change and violence and climate migration as well. And then we had a paper on mental health impacts of climate change in the Journal of Emergency Nursing. Next month, we have a presentation on healthcare sustainability initiatives to promote waste reduction. We think you'll be fascinated to hear about the efforts of the Center for the Environment of Health and Health. Dr. Jonathan Slutzman is the director, the head of the Center for the Environment and Health. He's an engineer by background and also an emergency department physician. And he, along with Barbara Belanger in the perioperative nursing services, who has an appointment with the Department of Patient Care Services and the Department of Nursing, they've done significant work looking at waste reduction and also auditing waste within Mass General to try and address sustainability initiatives, because as you may know, healthcare contributes 10% or more to greenhouse gas emissions because of one-use containers, things that are used in the emergency department, and the perioperative area that cannot be recycled. So please join us on Thursday, October 13th from 12 noon to 1. So it isn't a Monday that month, but we look forward to seeing you there. Thank you.
Thank you so much, Patrice. We will be sending out details to that upcoming session in October soon. We are now at the end of the session, so if you have any questions for Patrice, feel free to enter them in the chat. So Patrice, you gave some excellent examples of heat and the drought affecting us. Can you tell us a little bit more about how climate change has affected our mental health in the New England area? Sorry, Patrice, you're actually on mute.
Expand this. Thank you, Amy. So in the New England area, there has been a very interesting shift, particularly around climate migration, Amy. So for example, at one point there were migrants who came from Africa, and I'm not remembering which country, but they made a very complex route to the Mexican border. And then they heard that the Portland area in particular was particularly welcoming to climate migrants. So they traveled to the Portland area. I believe they were housed in a gymnasium in the Portland area and received very well in that area. As we know, it's a more moderate climate as you go further and further north. So for example, if it's 95 degrees in Boston, it may be, for example, mid 80s to low 80s in Maine. Those particular migrants eventually settled in mostly in the Lewiston, Maine area. But that's an example of climate migration related to conflict and violence, but also climate change. There was also literature that after the wildfires in California, there's an exemplar, and I'm not sure where I read it, but of a family who were affected by the wildfires. I believe they lost their home. I think it was in the Santa Barbara area, but it could have been the Camp Fire further north. And they sought out where they should move to avoid the incredible challenges that are going to face us around climate change. And they selected Vermont as the state where they relocated their family. So those are two examples around climate migration. Another example is the fact that because of sea level rise, Amy and colleagues, that there are areas along the coast that are well identified in Climate Ready Boston, which is Mayor Wu's Climate Resilient Boston effort. She has a climate champion with an appointment in the City of Boston office. And you can look at the City of Boston and Google Climate Ready Boston. And she has it neighborhood by neighborhood. The areas that are at risk because of climate change. So for example, East Boston, even though there's a lot of building and changing environment with high rises and expensive housing developments that are occurring, and they're trying to develop parks at the coast to be able to absorb for sea level rise and avoid flooding, there's still a likelihood that should a hurricane, for example, strike this northeast area, that there are significant areas in East Boston, in Charlestown, and certainly in the Seaport area, that even without a hurricane, we have seen evidence of sea level rise and flooding in our very new Seaport area, that significant areas are expensive buildings and well built, but we know that we've seen evidence in the lay press of, for example, I saw a dumpster going down Seaport Boulevard at one point a couple of years ago because of flooding that was not even hurricane related. So that's probably the most significant risk we have, a sea level rise and heat stress.
Thank you. Are we involved in any efforts, we meaning Mass General Brigham, in any efforts to address climate change and or support those in need of mental health support?
That's a terrific question also. So because Dr. Slutzman is in the emergency department, he's very well aware not only of sustainability, but of the importance of mental health impacts. We had a paper that actually developed a framework called A-Climate, which is an acronym for how emergency departments should address climate change. And this means physicians, nurses, social workers, physician assistants, nurse practitioners. I don't want to leave anybody out, physical therapists. So every discipline should think about how you assess for climate change related impacts. So A is assess for life and limb threatening injuries. C is consider climate related impacts unique to your environment. So each one stands for something. What's most important is that when somebody comes into the emergency department, that everyone from the patient care assistant, the medical assistant, the person who's triaging someone, think about the fact that if it's a 95-degree day, are you thinking this is heat-related illness if the person's confused, rather than just a stroke, sepsis, an elder who may be experiencing dementia? I'll give you one exemplar, which I think is very helpful. And this may have been shared in a previous presentation, but I have a colleague who has an elderly parent who on a 90+ degree day went out in an air-conditioned automobile to go food shopping and then was involved in a very minor fender bender, went out to exchange papers, and then after about 10 minutes in the heat experienced acute confusion. The emergency medicine services, EMTs, were called and transported her to an emergency department, who immediately considered in their assessment chronic dementia with an acute component, sepsis due to, for example, a urinary tract infection, so a complete body infection due to urinary tract, a stroke, an acute stroke. Nowhere did anybody think about heat-related illness with heat stroke, even though her temperature was 103 degrees. And we know that 98.6 is the normal. And 103 in a climate, in a high stress, high heat environment is heat stroke that needs to be addressed urgently. So in this particular circumstance, the patient went to a neuro ICU at another hospital, was transported, which was appropriate because she did have heat stroke, even though that wasn't what they thought she had. But when she was discharged, she didn't even receive any heat-related education. And this was not in a Mass General Brigham hospital system at all. But it could happen in any hospital system. But that's an example of where health professionals, but all of our lay public need to be acutely aware for protection of themselves and their health, their family members, and to be able to consider mitigation, limiting exposure, adaptation, adapting to, for example, heat stress, and then resilience. How do you remain resilient in a climate changing world?
Thank you. With the fall and winter seasons upon us, are there any climate change concerns that we need to start thinking about?
So because allergy season has extended, many people may still experience allergies well into October. So for example, we know just the foliage change occurs later because of a warmer environment in our area. But allergies is one area, and asthma and exacerbation of allergies can be a part of that. I think that's probably the major area. And for people with chronic cardiac and respiratory issues, they have to be aware of that as well. I think those are probably the most important areas that I would think about. Mosquitoes, triple E in this area, I think is just one other.
Thank you. For those who want to learn more about climate change and the impacts on our health, do you have any recommendations on what website they can visit to learn more?
Yes, the Centers for Disease Control and Prevention. If you Google Centers for Disease Control and Prevention climate change, the resources that they have, and they're in layperson's terms because, of course, they're funded by our federal government so that everybody who's a U.S. citizen can access and learn more. They are incredible. And they're also broken down by different disease processes. They have air quality, they have vector-borne illnesses, they have disaster. They are the richest resource that you can really access.
Thank you. While we wait to see if there are any final questions in the chat, do you have any final thoughts you'd like to share with the audience?
It's been so wonderful to be joining you for this climate and health series. And we're developing the calendar for November all the way through the spring. We hope that you'll continue to join us. I do want to share, I shared this with Amy prior to us initiating this session, that we've had 2 invitations from the community because of the robust interest in health consequences of climate change. So we thank you for that. The first invitation is from the Museum of Science, and they asked Sue Ellen Brakey and me to join in October on a Saturday when families are there, families of all generations, children, parents, grandparents, extended families, and visitors, of course, for us to talk about health consequences of climate change. So we're really excited about that opportunity with the community, thanks to Ms. Sam and the Blums and the Blum Center and the Department of Nursing and Patient Care Services. And also there's a photo exhibit. It's an international photo exhibit in Vermont. And we've been invited because of an attendee at the Blum Center for us to also broadly discuss health consequences of climate change. So would love to have you spread the word.
Happy to do so. Thank you so much. And stay tuned, more details to come about our spring schedule. All right, so we have time for one last question. How can, as a healthcare system, can we help the immigrants newly arrived in Massachusetts adjust to the climate changing of the Northeast?
That is a terrific question. And what's so interesting about that question is adjusting to cooler temperatures is actually easier if one provides people with the necessary clothing, the necessary sleeping environment where they can be warm enough as the temperatures cool. What is more challenging is when people travel to warmer, more humid environments. So one example from the scientific literature is for farm workers, for example, in the Northeast, and also landscape workers. In the Northeast, it's incredibly challenging in the summer months for farm workers and agricultural workers in 95-degree heat with high humidity. They're certainly at risk of heat-related illness. However, in the South, it is even more challenging. They have to acclimate to the high heat and the humidity. So for example, if we had migrants who went south and began doing migrant farm work, for example, they really should be carefully watched for heat-related illness because of the heat and humidity and the shifts in what that experience is like for their bodies. They're at risk of chronic renal failure from dehydration and lack of access to enough water. And this is in the literature, including in the nursing literature. Linda McCauley, who's the dean at Emory, has done significant work around the risks for chronic renal failure in migrant farm workers, particularly in Florida and the South. But to your point, newly arriving in the Northeast is generally a cooler environment, which can be an easier adjustment than if people are migrating to the Southeast in particular.
Thank you. Well, I think that's all the questions that we have for today. Patrice, thank you again for a wonderful presentation. Everyone, thank you so much for joining us today. Hope you find today's session helpful. As I had mentioned, the session is being recorded. So if you are interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.